One of the next exciting frontiers of joint replacement surgery is robotic surgery and personalization of the experience. We've had tremendous success over the past several decades of doing successful hip and knee replacement. But the next frontier focuses on cutting down the outliers, reducing those complications. This is, after all, a man-made intervention. These days, the hospitals that I operate in, we have access to robotic-assisted hip and knee replacement. Oftentimes, we'll take advanced imaging before the surgery, and that's plugged into a team of engineers who spend a tremendous amount of time planning based on the patient's specific anatomy. And they decide how much bone needs to be shaved off and take the exact amount of arthritis off of the joint. And the exact fitting implant is selected even before you enter the operating room. And once you're in the operating room, it's no longer left to the surgeon's decision, but rather a very complex set of algorithms are used, so the robot essentially takes over to allow for precise measurements and shaving of the arthritis, and you get an optimal experience with hip and knee replacements. If you're interested more in robotic surgery, call us or visit our website and schedule an appointment. Let's have a conversation. Maybe you're the right candidate for such a procedure.